Imagine millions of beloved poultry, chickens, turkeys, and ducks, being culled in a desperate bid to curb a relentless virus, all while the government's watchful eye seems to be dimming. That's the stark reality of the bird flu outbreak sweeping through America right now, and it's a crisis that's not just about farms, it's about our food supply, our health, and potentially, a global threat. Stick around, because this isn't just another news story, it's a wake-up call that could affect us all. As migratory birds head southward this winter, they're unwittingly transporting a dangerous passenger, the H5N1 virus, commonly known as bird flu. In the last month alone, this highly contagious pathogen has infiltrated 66 poultry flocks, resulting in the heartbreaking destruction of over 3.5 million birds. To put that in perspective, that's like wiping out entire flocks on hundreds of farms, far more than the sporadic outbreaks we saw during the summer. The virus spreads rapidly when wild birds come into contact with domesticated ones, whether in large commercial operations or small backyard setups. It's a classic case of nature's interconnected web turning perilous. Currently, the central states are bearing the brunt of this epidemic, with farms facing wave after wave of infections. But experts warn that as birds continue their seasonal journeys, we could see the virus erupting in other regions too. This migratory pattern isn't random, it's a predictable pathway that scientists have studied for years, yet it feels like we are playing catch-up. And if we don't treat this seriously, the consequences extend way beyond grocery store shelves. Think skyrocketing egg prices and shortages that disrupt your morning routine. Influenza specialists are sounding the alarm, fearing a repeat of last year's scare when the US reported nearly 70 human infections for the first time ever, tragically including one fatality. We are absolutely going to see more human cases, just as we did last year, explains Seema Lakdawala, a virologist at Emory University specializing in bird flu research. Nothing fundamental has shifted to prevent it. For beginners wondering what H5N1 is, it's a subtype of avian influenza that primarily affects birds but can jump to humans, causing symptoms from mild eye irritation to severe respiratory issues. Though no new human cases have surfaced since early this year, the experts tracking this are in the dark about the full scope. The federal government has dialed back its surveillance and public communication efforts, leaving a troubling gap in our defenses. We are not well positioned to monitor the situation effectively, says Wendy Purrier, a Tufts University virologist who's been immersed in H5N1 studies since it hit US shores. It's putting me in a really uneasy spot. But here's where it gets controversial. These cuts stem from the Trump administration's policies, including staffing reductions, early retirements, and funding slashes that have dismantled key networks. Purrier describes how a collaborative group of influenza researchers once worked hand-in-hand with federal agencies, sharing insights and planning responses. Now, that infrastructure is either shuttered or severely limited. She recounts a recent meeting where one colleague after another announced they'd abandoned their H5N1 human studies due to slashed budgets. It was disheartening, she admits. Like watching doors close one by one. Adding to the frustration, data from the USDA's lab that sequences viruses from infected animals has slowed to a mere trickle, a problem predating the recent government shutdown. Dr. Keith Paulson, director of the Wisconsin Veterinary Diagnostic Laboratory, points to staff losses and the need for pre-approval on communications as major roadblocks. He calls it a national security vulnerability, exacerbated by the shutdown, which halted routine meetings among veterinary labs. It's like adding fuel to a fire that's already burning, he warns. The USDA declined to comment, while a Health and Human Services spokesperson emphasized that the CDC's influenza team remains intact and ready for emergencies during shutdowns. Yet, scientists on the ground paint a different picture. Containing the virus on farms is notoriously tricky. Official reports show dairy herd infections are still uncommon lately, thanks to a bidenary USDA program that tests milk for bird flu and rules requiring cows to be checked before interstate travel. That said, routine cattle testing is shrouded in uncertainty, some speculate the dip in reported cases might simply reflect fewer checks. Lakdawala's research offers a chilling glimpse into why eradication is so hard. The virus lingers everywhere on farms, in the air of milking areas, on equipment, and even in waste used for cleaning barns. Cows shed massive amounts of the virus through their milk, even if they show no signs of illness, creating an inescapable cycle of reinfection. These animals are surrounded by so much virus that infection is almost inevitable, she notes. This highlights how modern farming practices, like the constant movement of cattle between farms, can unwittingly fuel outbreaks. Fortunately, the circulating H5N1 strain hasn't mutated in ways that make it highly transmissible to humans. But Lakdawala stresses the dangers for farm workers exposed to aerosolized virus particles. In Minnesota, hit by around 24 outbreaks since mid-September, epidemiologist Karen Martin at the State Health Department is tracking about 35 exposed individuals. They're coordinating with CDC experts, but she's worried about sustaining resources. "We're managing for now, but what if the outbreaks keep coming?" she asks. And this is the part most people miss: the urgent need for better testing among farm workers, the frontline heroes most at risk. Human cases are often mild, showing as eye infections or subtle symptoms that get brushed off. A recent CDC paper calls for comprehensive tracking of asymptomatic infections, with a small study revealing past exposure in 7% of dairy workers in Michigan and Colorado. But gaining cooperation from farmers and often undocumented workers is tough, especially now. Bethany Bogus-Elcorda from the National Center for Farmworker Health explains how Trump-era immigration fears have heightened reluctance. "People are terrified to leave home or participate in testing," she says. Interviews in California this fall showed 20% of surveyed workers in 3 states had symptoms while animals were ill, yet most went untested. Dr. Nirav Shah, who led the Biden administration's bird flu response, argues the CDC's decision to scale back emergency status was reasonable, but it shouldn't halt vital monitoring. "They're gambling that nothing big will happen, but with pandemic influenza, that's a risky bet," he cautions. So, what do you think? Is the government's reduced involvement a pragmatic choice or a dangerous gamble that leaves us vulnerable? Could stricter policies on farming and immigration actually help, or would they stifle the industry? Share your views, agreements, or disagreements in the comments. We'd love to hear a debate on this.